There are over 4,000 deaf people using British Sign Language, or BSL, in the NHS Greater Glasgow and Clyde area. By law, we must provide British Sign Language interpreters for our deaf patients, both at health appointments and when they're in hospital.
Hi, my name's Paul and I'm deaf. Like most BSL users, British Sign Language is my first language, not English. You can't assume that BSL users can understand English well. Some may be able to read and follow written instructions, but others won't. Even if someone can read, they may not know many of the words commonly used, such as urine or texture. I know many deaf people who have left their appointments not knowing what was said. Can you imagine the impact this can have on someone's health and well-being? An interpreter is vital to ensure we are fully aware of our condition, our treatment, and any further steps that need to be taken.
Clearly, it's not possible to undertake an assessment or give instruction or communicate complex health information to a deaf person without a British Sign Language interpreter. Any other method leaves too many possibilities for misunderstanding and gaps in information. We must be able to assess the patient's comprehension of what they're being told. Booking a BSL interpreter for our deaf patients is a requirement of governance, and any breaches of this must be recorded.
An interpreter should be booked for every patient appointment. For inpatients, an interpreter should be booked for key parts of the patient journey, on admission, for doctor's rounds, and for discharge. An interpreter should also be booked to discuss key decisions, for example, if the patient condition deteriorates, and also to communicate with family members if they too are deaf. When the patient is admitted and the interpreter is present, use this time to establish a communication plan. Agree when an interpreter will be present so that the patient is fully aware. At this point, you should also discuss the patient preferred method of communication for when the interpreter is not there. These will vary from person to person and may include the following: lip reading. Make sure the light is on your face and don't cover your mouth or turn away. Speak slowly. Even a good lip reader will only get around 30% of the information, so always check that the patient has understood. Writing things down. Some deaf people can read English, so writing things down may help. Using flashcards for drink, toilet, medication, etc. might also be useful. Online interpreting. An online interpreting service is now available on various sites across NHS Greater Glasgow and Clyde. This means that you can quickly link up to an interpreter at any time, 24 hours a day, 7 days a week, and communicate with your patient. Check StaffNet's interpreting page to find out where you can access the service.
If it's an emergency or an unplanned visit, book an interpreter as soon as possible. In the meantime, use the online interpreting service, writing or lip reading, to let the patient know when the interpreter is coming. Don't use gestures, they don't work.
Some deaf have a voice, not all of them. At the end of the day, we are deaf, we can't hear you.
The provision of interpreters is paid for directly by NHSGGC. There's no cost to your service. However, it is the responsibility of the staff member to book the interpreter. To book a BSL interpreter, contact the NHSGGC interpreting service on 0141 347 8811. The interpreting service operates from 8 AM to 6 PM Monday to Friday and 8 AM to 4 PM Saturday and Sunday. Patients may have a preferred interpreter that they would like to use for their appointment. This information should be passed on to the interpreting service, who will try to book the person or organisation the patient chooses. If this is possible, try to get consistency of interpreter for inpatient stays. If you need an interpreter out of hours, either contact the patient choice of organisation if they have this information, or call 0141 347 8811 to be connected to the appropriate service. For A&E or other emergency situations, please explain the circumstances when calling. Let them know you will need an interpreter as soon as possible. To book a deaf-blind communicator for those who are dual sensory impaired, contact 0141 777 6111, Monday to Friday, 9 to 5. For out of hours, call 07715 421 388. Everyone delivering services to patients should be aware of the need to book a BSL interpreter. Please share this information with your colleagues and help us to ensure that our deaf patients receive the best possible care.